Brian, is it the final hour already? Are you kidding me? This is the Gary Sutton Show here on WSBA, the final hour, the final day of the week, the work week, that is. As we head into the weekend, I am Gary Sutton, and a good morning to you. And we can't say that for much longer either, can we? But a lot of people talk, and by the way, if you wanted to keep on asking questions about that March 18th thing, 11:35 this morning, we'll open it up. It'll be total open lines again for you. You've been wearing them out today, and I love it. At 1-800-357-0910. You can tweet me at Gary G. Sutton. I'm really kind of into this social stuff now. I used to be antisocial. Now I'm social, and also Facebook.com/910WSBA. Feel free to weigh in at those. And if all else fails, Gary.Sutton@Cumulus.com. If you need to, come in and see me, okay, face-to-face, if it's that bad, all right? 1-800-357-0910. Second week. We're finishing up our second week on our brand new old slot again. We did this for 8 years. And in those 8 years, the first time around, before I did this 9 to noon slot, I met Bev Mackereth, who at that time was the representative from the 196th, then went into some York County health kind of things. Yep. You want to hit that red button there real quick? There we go. And I'm teaching her all about radio again this morning. So,
and I love it.
And now she's the head of the Pennsylvania Department of Public Welfare. Good morning, Beth. And she's here in the studio. You were so nice to come in today. I appreciate it.
Oh, I'm very happy to be here, and I'm happy that we have the opportunity to share with the listeners about Department of Public Welfare, because as you and I were just talking, there are so many misconceptions about what we do. Yeah.
And, and one of the things that we bill ourselves here is we're in search of common sense and truth all the time. And that's one of the things that we want to do today here on the Gary Sutton Show. I'm going to get Brian over here really quickly to fix your headset for you. But, it's, we hear a lot of myths. We also hear, what we think is reality sometimes. And we want to try to kind of separate those two things out here this morning. One of the jobs of, I think, our show is to make sure that people understand what the truth is and what the perception is sometimes, because I'm one who will say, when I see abuse out there, other people see abuse out there, you get really, really upset. But let's talk a little bit, first of all, Bev, about what the Department of Public Welfare does here in the state of Pennsylvania, kind of what the mission statements are, because I know you cover a wide variety of things.
And actually, Gary, we are the largest department of state government in the country.
Wow.
And whether that's right or wrong, I don't know. I'm still trying to figure that out, what it could or should look like. But for now, we deal with everything from birth through death.
Yeah.
And so we deal with early childhood education issues, daycare centers. We deal with child abuse and neglect, juvenile justice, mental health, drug and alcohol, people with disabilities, and seniors. So we cover the gamut of needs, and we're really the safety net agency for the most vulnerable Pennsylvanians.
You hear people in conversation all the time, and we have that conversation here a lot. Mm-hmm. And people say, I see people out there abusing food stamps or abusing welfare and doing all that kind of thing. And I think we tend in society to paint everybody with a broad brush, that if one's doing it, then they're all doing it.
Yes.
And you're in a situation now looking at it where you say, well, that's probably not the case. And I think that's one of the things we want to try to separate out today right away.
Oh, and I appreciate that, because I do think people need to know. You may always see that. I mean, there's always going to be somebody out there that tries to milk the system.
Yeah.
That's just the way it is. And we're building in, through our Office of Program Integrity, we're building in some best practices in some ways to detect waste, fraud, abuse. However, that is such a small population of the people that we are serving in Pennsylvania. I think that, as you and I were just talking off air, most of the people that we serve and most of our dollars go to people who are our most vulnerable. So people with serious disabilities and many of our seniors. And that's really the most high cost. DPW has a budget of $28.4 billion.
Wow.
That is the same size as the entire Commonwealth of Pennsylvania budget. And 2.2 million Pennsylvanians are served in some way through the Department of Public Welfare. But there's only about, I think it's 168,000 or so that actually are the welfare recipients that people are so concerned about. And it really does we do paint it with a broad brush. Most of the work that we do every day is really to ensure that those that need it the most get what they need.
one of the things that you have, and I was reading your mission and vision statements, and I was really interested in this. And by the way, you don't mind taking some calls, right?
Absolutely not.
1-800-357-0910 if you'd like to talk to Bev Mackereth this morning, the head of the Department of Public Welfare. She's with us in studio here on the Gary Sutton Show, and always glad to see your shining face. You say our vision, your department says, our vision is to see Pennsylvanians living safe, healthy, and I like this part, and independent lives.
Exactly.
Independent lives, because we talk about the battle in our country today between independence and dependence, and we look at the people, we say, well, they're living off the independence, and there's a redistribution of wealth and all that kind of stuff. And are my tax dollars paying for this?
Exactly.
So what we're trying to figure out this morning is, what are our tax dollars paying for? We also see, every year when you, especially in election year, you see people say, well, look at the amount of welfare in the state right now. It's 35, 36%, whatever it might be in a given occasion. Address some of that.
Well,
because you're, I like it because you've been a representative. You've seen it from one side. Mm-hmm. Now you're at the top of that agency. You've seen it on another side. You've worked here in York County on health-related issues. You've
Absolutely.
seen it from that side. So you've got a kind of unique look at this that I don't think a lot of people can have.
Right. And believe me, when I came back, when Governor Corbett asked me to come and be the secretary of the Department of Public Welfare, my perception of what I was walking into has become a very different reality. And so as I'm looking at it, most of our budget goes to Medicaid. And Medicaid is health care, nursing home care, things I think everybody out there, all your listeners, think about, as you age, think about somebody who has a serious disability who can't work. How do we improve their quality of lives enough so that they do become independent? That really is what our role is. It's not to keep people on the government rolls forever. Now, there will always be people. I've had the opportunity over the last year to travel across Pennsylvania to go to some of our centers with people with disabilities. And there are individuals whose lives may never get better, who will always need to be on the government rolls. And we have to do what we can to help them. But really, Medicaid is 75% of our budget. And it's 30% of the entire Commonwealth of Pennsylvania budget. Healthcare, and again, a lot of nursing home care, right, and some of our community and home-based services. One
of the things that I'm wondering about, as you just mentioned Medicaid, I'm reading stories all around the country now where a lot of people, because of the Affordable Care Act, who before did not know that they were eligible for Medicaid, are now going to Medicaid.
Yes.
And how is that affecting you in terms of the services you provide and also the amount you've got to kind of provide for in your budget?
Right. It's created a problem for us this year in a very difficult state budget year. And so we have it sounds a little derogatory, but it's the term that's being used, woodwork. And woodwork are people who are already currently eligible for Medicaid, but have never signed up. And with the new law, all the publicity, we are seeing a clear uptick of people who are now signing up. So yes, that's more costly. Now, Governor Corbett has come out with this Healthy Pennsylvania initiative, and that is not an initiative to put everybody into Medicaid. That's actually an initiative to ensure that the 500,000 plus Pennsylvanians who are uninsured can purchase a private coverage option. So they will have health insurance. We will use the federal dollars for the purchase of that health insurance, but we will not grow Medicaid. Medicaid was really created for our most vulnerable.
Yeah, that's what I thought.
And if we continue to expand it and build onto it and add more populations, our fear is that the dollars will not be there for the people it was intended to serve.
And yet the people that come up with this plan, the Affordable Care Act, didn't take that in consideration about where people would go. And of course, now they include them in the numbers when you see them out there as people who are now covered who weren't covered before, which to me is charlatan-esque, if you will.
Right. Well, and again, that's why the governor said to us, come up with a plan that does not grow that entitlement program, but that does provide for people to get health care. And you know what? Health care is truly the underlying issue for everybody and everything.
It is.
And so recognizing that, we know that if we don't help people to get their health care needs met, in the long run, it's going to cost us more.
Yeah.
A big portion of that, by the way, is drug and alcohol, mental health issues. So we recognize that.
1-800-357-0910. We got Craig in Hershey who's got a question for Bev Mackereth. Craig, Go ahead.
Yeah, how you doing, Gary, Bev? How you guys doing?
Hi,
Doing great.
good.
Thank you, Craig. Go ahead.
Good. Beverly, did I hear you? This is for the Commonwealth of PA. Did I hear you correctly? You said your budget is $28 billion?
Yes, but it's still all taxpayer dollars, but it is state dollars, federal dollars, and some other funds. Yes, it is a huge budget.
Yeah, I'd say it's a huge budget. It seems like it's an entitlement that has grown out of control. To be quite honest with you, I have a friend of mine. I'm not going to mention his name. He works for the Department of Welfare up in Harrisburg. He told me face to face that he's one of 60 people that work in the department, and they don't do a thing, he tells me, all day long.
Well, and
Beverly, this man is a very honest man. And I find it, to be honest with you, when I hear a budget of $28 billion, that's an unbelievable amount of money for one state that handles welfare. It blows my mind. I can't comprehend that, to be quite honest with you, Beverly.
Well, let's take this and figure out where it's all going, Craig.
Exactly.
Maybe that's the next question here. And tune in. And thank you for your question and your call. We really appreciate you listening, okay?
Okay, thanks.
Thank you, Craig. So $28 billion, he's saying he's got 60 people that don't do a thing. I kind of think that's a pretty big generalization. Your response?
Well, number one, my response is, as I said, 75% of those dollars are in the Medicaid program. And the Medicaid program, it is expensive for nursing home services, for community and home-based services. And again, Medicaid is created for the people that need it the most.
The neediest people in society.
Absolutely.
Right.
And again, that is state and federal dollars. If there are 60-some people, interestingly, I was under the same assumption. When I went back to Harrisburg, I was like, I heard the same things. State government people don't work. They don't do anything.
Redundancies everywhere.
Yeah, you hear it everywhere. And I can tell you that at the Department of Public Welfare, I have met the most hardworking, dedicated people I have ever met. Now, could there be pockets where people aren't working as hard as they can be? I would imagine in any business, public, private, there will be. But I have not seen that. I meet with staff. I go all over the Commonwealth, and we have what's called brown bag lunches to listen to what the employees are saying. We have a lot of employees, and we have a lot of work to do, but we are trying to tighten things up. So I would welcome knowing as much as I can, because, again, we can't watch over everybody.
Right.
We're in every single county in Pennsylvania. But I think it's also important to remember the breadth of duties that are assigned to the Department of Public Welfare. Again, from early childhood, all the daycare facilities all over, we have licensing responsibilities. Child abuse, child protection, we are responsible for all of that. We license many of the centers, juvenile justice, mental health, drug and alcohol, intellectual disability. So it's the gamut of people from birth through death. So I think that's important.
When you talk about the $28 billion, which is a large budget, there's no question about it. However, I didn't know you were in charge of all the licensing and that kind of thing. I mean, I'm learning just by reading through a lot of things here to get ready for this today, how many things you're charged with. I mean, there is a breadth of things out there. And again, I'm not poo-pooing what Craig said, but I am saying, I want to learn. I want to understand. So when you talk about, people saying, okay, you got this huge budget and there's some people that cheated and so forth. What percentage is that? I guess is the big question. If you looked at it on a whole big continuum, what percentage do you think actually cheat? And
I can't give you that. What I can tell you is that we look every day, front-end applications, we look at back-end applications. We look for waste, we look for fraud, we look for abuse. We've built that into our operations.
Have you made that more acute than it was before you got there?
Since the day that Governor Corbett walked in the door, it has become an important issue that he wants to ensure is integrated into our operations so that whoever's governor down the road, 20 years, we can ensure that those red flags, those procedures are in place to catch waste, fraud, and abuse. So are we at where we want to be? No. but it's a slow process. I can tell you that since 2011, that we have seen $338 million in recoveries. We work very, very closely with the Office of Inspector General. There is a hotline number where people can report welfare fraud. You can't ever hire enough staff to watch everybody on that gets government benefits. But when it's seen, we need to hear about it.
Exactly.
And if people call it in, we investigate. And when we investigate, we do a very thorough job. The Inspector General does. We have many of the Inspector Generals housed with our staff so that they can work hand in hand. So again, is it important? It absolutely is. Another reason it's important is because if the dollars go to those that aren't the most vulnerable, that aren't the ones that are eligible for services, it takes away from the others that are.
We're going to take a quick break. We're going to come right back with Bev Mackereth, head of the Department of Public Welfare here in the state of Pennsylvania. You're welcome to give us a call, 1-800-357-0910. Want to learn more about all the services that are provided for that $28 billion budget, and you can hear there's a lot of things they've got to cover. We'll find out about it here on the Gary Sutton Show on WSBA. Welcome back to the Gary Sutton Show here on WSBA, where you'll get tired of hearing this. We're in search of common sense and truth every day. Aren't we all doing that? Let's go back to the phone lines. We have Bev Mackereth, who's the head of the Department of Public Welfare here in the state of Pennsylvania. In fact, you said it is the toughest job you've ever had, right?
Absolutely, it is.
Yeah. Why?
Because it's so large and because it really, the decisions we make every day impact people's lives.
Yeah. How many people do you actually work under you?
17,000.
Wow. Now, when we say 17,000, they're not all sit up there in a building in Harrisburg. They're spread out all over Pennsylvania. So I think sometimes we get the perception that they're all sitting around there in a huddle in a couple rooms. It's not the way it works, right?
Absolutely not. We have people all over Pennsylvania in every county. We have 93 CAO offices. That's our county assistance offices.
Okay.
We have, again, our juvenile detention centers. We have our intellectual disability institutional settings. Mm-hmm. We have still some mental hospitals, mental health hospitals. We have them everywhere. Yeah. We deal with providers. It's just huge. And
they all funnel right back into where you're at, right?
They do. Yeah. They do.
Which makes your life a wonderful day. And I guess it is a good day, and you know you're helping people, but you're also on guard for other people who may not really need that help. Let's get back to the phone lines quickly. We've got Kevin in Harrisburg who's got a question for Bev Mackereth.
Hi, Kevin.
Good morning, Kevin. Go ahead.
Good morning. Thanks for taking my call.
Thank you.
Listen, I'll let you. I'll lay out my problem and I'll hang up and let you respond to it. But I hear about all that money, the billions of dollars, and Craig brought up a very interesting point that's kind of on my mind. Our daughter, when we moved into this state, our daughter has a diagnosis of Down syndrome, and it took at least 9 months, if not close to a year, to finally get her Medicaid insurance. And the problems and the way it finally concluded was the level of incompetence with the Dauphin County Welfare Department was just mind-blowing. We had to submit the entire application at least twice. We had to send in the same paperwork probably 3-4 times. Our application would be denied because they didn't get this paperwork that we sent in 2 times, 3 times. I'd get on the phone and I'd say, all right, I'm going to send it to you now. Send it to you. Okay, you have confirmation that you received it. Yes, I would get the confirmation. I would get email confirmation. Now we have to wait for the application to go through. It would be denied because we didn't get that same paperwork that we just sent. It was just over and over. It came clear to us that it seemed as if they were just looking for a reason not to give us the insurance. Now, every so months, I guess you have to reapply or just attest to the application. We moved, and they sent us the paperwork, but since we moved, we never got it. They just canceled the insurance. We found out later that the insurance was canceled. Well, we sent you this paperwork. You didn't respond. I said, we moved. And why didn't you send it to the forwarding address? And they said, well, we don't do that. So we had no idea this paperwork was coming. We had no idea her insurance was canceled. But I just want you to address that because with all this kind of money, it just seems like, there are some people sitting around doing nothing. Thank you.
Kevin, thank you very much for your call. Bev?
Sure. Kevin, first off, thank you so much for your call. And, first off, I want to say that should never happen. That's not acceptable. And we are working very hard. I don't know when this was, but we are working very hard under this administration to ensure that public service is paramount to what we do, so that when something like this happens, when it's clear your daughter would need services and Medicaid coverage, there should have been no barriers to getting her that coverage. And so, again, we are working very hard to work with each one of our 93 CAO offices to figure out how do we streamline. Much of what we've had to do is to improve our IT capacity, our IT systems, because our IT systems we didn't have proper links. We were not able to get information in a timely way. We are now able to do that. So we're working very hard all the time to improve our systems so that this does not occur.
Now, for a guy like David that's there, he's saying, okay, that's great, but what about me right now? Is there a place he can call, a place he can go to try to get some immediate help on a situation like that?
Yes. Certainly he can call, and honest, Gary, I don't have the number with me, Department of Public Welfare number, and ask for the Office of Income Maintenance. If there is a problem, we will address it immediately. And we're happy to do that. It should not occur.
I'm looking right here. 1-800-692-7462. Does that sound right?
Sure.
1-800-692-7462 would be the number you could use there. Let's get Janet in New York very quickly. Janet, you're next up on the Gary Sutton Show with Bev Mackereth. Go ahead, Janet.
Yes. I have a person who works in the parole office in New York City, and they have people coming in there with papers from the welfare office to be signed so that they can get welfare. And there are DUI people and people that are on parole and that kind of thing. Shouldn't they be checked, really checked, to see who exactly is getting this welfare? Hold on a minute, Joan.
Okay. I think we got your question there, Janet. Yeah. Let's see what we do. Just hang up there and listen. And I'll tell you what, we're going to take a break because I'm a little overdue. We'll take a break. We'll come right back. Can you stick around with me for a little bit, Bev? Thank you so much. We're going to come back and take more of your calls. Bev's going to stick around here for a few minutes. 1-800-357-0910. And Janet, she'll have an answer for your question when we come back here on The Gary Sutton Show on WSBA. Welcome back to The Gary Sutton Show. We're taking your calls with Bev Mackereth this morning, who's the head of the Department of Welfare. And again, trying to learn a little bit more about the department along the way. And Kevin, thank you for your call back a moment ago. Kevin, who called in and said he had that problem, and I think you had a nice conversation with him off the air, and he said he felt confident that you're going to try to do something there with it. So
yes, I really, really appreciated that he called in, and I was also really happy to hear that it was before I started there, which was always nice to hear.
You know what? But people think you're going to be all things to all people all the time and always get it right. And I just said to you, you're sitting on top of a 17,000 person bureaucracy.
Yes.
Whether anybody, bureaucracy is a nasty word in this country, but it's like taking a dinosaur for a walk. It's slow and ponderous, but you might eventually get there. And yet, there's got to be days of frustration where you say, "Good grief, we didn't get it right today over here." But then there's got to be days where you say, "Man, we got it right over here," and it makes you feel good. But
that's what keeps you going to work every day.
Yeah.
Because we all have that. And again, when I talk about my DPW family, and we really have become family because we spend so much time together. These are people that we work till, we're on the phone at night, or there's people in the office to 9, 10 at night. They're in on the weekends. So it's not the stereotype of what you hear.
9 to 5.
Oh, not at all. And we spend a great deal of time together because we want to get this right. But what keeps them going is the same thing that keeps me going every day, which is knowing that we do good things to help the people that need it the most. And when you see the quality, when we're able to improve somebody's quality of life, when we're able to help a child who was abused get out of the abusive situation, when we have a juvenile delinquent who makes it, who comes out of our facility and does well, and I can go on and on and on, that's what keeps you going every day.
Let's get back to the phone line, too. We have Pam in Harrisburg. Pam, good morning to you. It's your turn to make the call with Bev Mackereth. Good morning, Pam.
Good morning.
Morning,
Good
Pam.
morning. Thank you for taking my call.
Thank you for taking the time. We appreciate it.
Thanks. I wanted to go back to your prior caller just for a moment. listening to him, I really kind of felt that I do a lot of work on improving things, and it really is not about the staff. It's about the work processes that you have your staff working on. So if you can improve the process, it's going to help with the people, and it's going to help better outcomes. My question is, I do a lot of work in public health, and wanted to understand if public health is within your budget. And also, my last question is, if I'm a citizen of Pennsylvania, as I am, how do I know when to use your services versus public services?
Good questions. Thank you,
great
Pam.
questions.
Go ahead, Bev. Thank you, Pam.
First, I totally agree with you. I think it is process, and a lot of what we do now, we're trying to upgrade our IT systems and the technology, which would make it easier for our staff. And I agree with you. A lot of what you find with any individual is there will be some human error. Mm-hmm. So as we upgrade our systems, and it has taken us a long time to get to the point where we need to be, and we're still not there. We're getting better, and we're going to continue to do that. So great point, because it truly is the processes that need to be updated. So we're working towards that. Secondly, much of the public health issues are dealt with through the Department of Health. And the Department of Health is in the same building. It's Secretary Michael Wolf. And so they are partners. We work with them very closely, but it is a different Department of State government. And your third question
was, when do you know to go to them or somebody else? Yeah, the public.
So I would go to our website if you have access to a computer. If you don't, go to a library if you can and take a look and go in, and it will tell you what are the things that we do. If you are an individual who believes you may be entitled to services, then we have what's called the Compass application. If you click on the Compass application, you can fill it out, and it will tell you if any services would fit your needs. And that's the easiest way to find out whether or not there are services that you can benefit from.
Let's grab Gary very quickly in a truck out there somewhere about a physical for PennDOT. Gary, go ahead. It's your turn to make the call with Bev Mackereth. Go ahead.
Yeah, well, first off, I want to say thank you for the work you do. Some of it is good.
Thank you.
Just wish you could keep after more of these people that probably shouldn't get it or could do better on their own.
We're working on it.
The young people that do work. Yes, there's a lot of good people out there helping to pay for it. It'd be nice if they could keep more of their money in their pocket.
I agree completely.
My question, or my thing about it, isn't about the welfare system at all. I didn't realize that's basically what you were talking about when I called. I just tuned in a little while ago. But us truck drivers now here in our fine state, when we get our physicals for driving, of course, and nowadays we have to get our physical card signed by the doctor, which we always did, but now we have to go and get it blowed up to 5x7 and then sent in by mail, or if you don't trust the mail, which I don't, I have it sent in by a notary, for somebody in PennDOT to look at it and decide whether they can read the doctor's signature. That's what happened to me last year. This is about as goofy as could be. Sounds like a real waste of money that could be used somewhere else. But they actually have somebody in there that turns down the doctor's signature on your physical card and sends it back and make you go and get it re-signed so that they can read it.
I didn't know you were supposed to ever be able to read a doctor's signature. I didn't know you could do. I'm saying that tongue in cheek, actually, but understand what you're saying.
It's the truth. Yeah, it's goofy.
Yeah.
I mean, I don't know anybody that can read a doctor's signature. Now
exactly.
Pharmacists, I'm not sure they can actually read them, but they see them so much they know who it is. But now, where is it that we got people qualified from PennDOT? Do we send them to a special school, to learn to do that? I mean, maybe we should use that money at the special school to teach some other special people special things there, because PennDOT people, they should probably be standing there behind the counter signing people's driver's license or something, right?
Yeah, maybe get them out there where the rubber meets the road. Probably good for you to say it, where the rubber meets the road, where you meet the public, and quit making your job. See, again, you want to build in safeguards, I'm sure, to make sure you are who you say you are. But on the other hand, let's not inconvenience the citizen over and over. And I think that's where the rub comes on any kind of bureaucracy anywhere, be it federal or state, or even county for that matter. Yeah, point well taken. Gary, I got to run. I got to run real, Gary, because I got to get another call. But thank you for calling in. Really appreciate it. Want to grab Joe in Dover here very quickly. Joe, you're with Bev Mackereth on the Gary Sutton Show. Go ahead, Joe.
Hi, Joe.
Good morning. Good morning, Gary. Good morning, Bev. Bev, congratulations on your appointment. I've known you for a number of years, and you've always been a very capable and compassionate person. So it's great because lots of times the people that are being helped, the majority of people that are being helped on welfare, are really the ones that need it. We do need a safety net for those who fall through the cracks. And I'm sure most people will pay more taxes if they know that those taxes aren't being wasted. And, of course, that's all you ever hear about welfare. And I guess I was wondering what programs have been specifically put in place to find that waste. And I guess you need to inspect what you expect. I'm sure that's a manpower problem. Mm-hmm. And I'm sure there's many people that know the system and know the rules and regulations and know how to get around it. So that's probably an encompassing situation. But what kind of programs they have to try to get those individuals and save us some tax money so they can go to the people that really need the help.
Joe, thanks so much. Really appreciate it. Bev?
Well, Joe, first I'd like to say great common sense, because what you're talking about is exactly what our mission is. And it deals with ensuring that the most vulnerable get the services they need, and those that are not entitled to services don't get them, because we need to make sure that the taxpayer dollar is spent the way it should be. So I appreciate that first. We have a program integrity office. It was created in November of 2011 under the Corbett administration. It has been extremely successful, and we build on it every day. It's not just about an office, though. It's about taking what we've learned and then operationalizing it into what we do every day, so that it's not about a person who we have to hire to go in and look through files. It's actually about every worker who is actually doing the files, looking for red flags and saying, you know what, this doesn't look right, we need to check it out. It's about our partnership with the Inspector General's office, having them as a teammate in our CAO offices, able to immediately respond when we're not sure that, somebody's telling us the truth, when we get paperwork back that shows there could be some fraud. We also have implemented audits for providers. The truth is that the individuals we're talking about really, there will always be individuals who try to scam the system. Mm-hmm. We know that. We are trying to catch it. But really, we have to look at our providers, too. Are they providing the service that they're billing us for? That's huge. And to do that, we are doing audits. That, of course, is a manpower issue. But we're looking at data. We're reviewing, what does the data show us? Are there things that are happening that shouldn't be? And even one example for individuals. So we're looking at people with the EBT cards, and that's their benefit cards. And are they using it out of state? And if for 3 months they're using it out of state, we're not sure that we're looking at it to see what's really happening. Why would they be using it out of state? Do they live out of state? We're also looking at, for instance, people that ask for multiple cards. They say they lost it, we need a new one. Why would you need a new one that many times? So we're taking a look at that. As we build our system to look at other systems, I believe by June we'll be connected with PennDOT, with revenue, so that we're going to be able to have real-time information about people, which should cut down on lost paperwork, which should cut down on what we heard, people losing paperwork, things like that. So we want to cut down on the bureaucracy, but be able to identify if there is a problem or concern. So again, a lot of data is being looked at, and again, building it into what we do every day. And that's really what's going to make the difference long term, that we're going to be able to catch this. You said so far $338 million has been kind of recouped. Yes. Which does show progress. I mean, oh my gosh, we've made tremendous progress. And every day we look at how do we do better. Yeah. And that's what's important. So our Office of Program Integrity looks at each area. What could we do different? How do we implement? One of the biggest problems out there, Bev, and I'm not sure it's one that your department could necessarily address, although you probably do in some ways.
I took a walk down through York one night from 10 to 1 in the morning, and it was interesting. I went down with a bunch of friends who really knew the city well, and found out an awful lot about generational welfare, fraud, and things like that. How do we help? And we're going to take a break here in a second, but I want you to think about this answer when we come back. How do we help? Okay, so we nip welfare in the bud right there on that situation, but how do we help the attitude of getting people away from playing the system generationally and teaching the next generation to do that, and getting back to the idea of being independent, or as independent as you humanly can be, and doing something with your day? What do we do there? I know welfare to work situations are thrown around by our politicians a lot, but you and I are talking about real policy. We're going to do that when we come back. I just want to ask you that question and see what you have to say when we come back. Bev Mackereth, who is head of the Public Welfare Department of Pennsylvania, is with me here on the Gary Sutton Show. I'm getting punchy. We'll be back with her answer right after this on WSBA. Welcome back to the Gary Sutton Show, our final segment here today. I can't believe we're going to have this up, by the way, on Facebook.com/910WSBA. We even have a picture of Bev, which Brian Dean is really on the hook here because he took that picture and Bev said, if it's not a good one, there's going to be a hell to pay. So anyway, yeah. So that question, yes, you might solve welfare fraud at the moment, but what about the generational thing that's going on? And I've seen a number of those cases, a lot of that. And again, a lot of that, it may be a smidgen part of the whole thing in Pennsylvania, but it's what rankles people. You see people out there, and I hear a million times, somebody at the grocery store in front of me is using their card and they're getting away with murder and all that kind of stuff. So how do you answer that? How do we get to those people and maybe start to teach some independence again instead of living off the entitlements or cheating what is supposed to be going into real people having real problems?
Well, Gary, that's a great question, and I think that's something that we all need to think about, because as you talk about what our budget is and how much money we spend, we could be spending it better. And so I would say to you that it's all about education.
I'm just going to say that's where it comes
from. It's all about education. We have to ensure that number one, for children that need to be in early childhood education, that they are out of their homes, they're learning to read, they get a hand up and get the skills they need so that by the time they get to third grade, there is not a child in Pennsylvania who cannot read, who cannot do basic math, because we know that children that can't read by third grade are our children who end up frequently in our juvenile justice system and on welfare. Then our K through 12, we've got to invest and make it the strongest that we can. We can't just move children up the ladder. You were a teacher, Gary, you know that. And if we provide them with that education, that is the only way that I believe that we're ever going to truly break the cycle.
But again, with all the things that are yoked on the citizen right now, and they hear the word invest and they hear, higher taxes.
Doesn't have to be higher taxes.
But I'm saying when they even if you say invest, they say, okay, I'll buy into that, but I want to make sure that it's going to something. I want to make sure that I see some kind of measurable thing out there, whether it's over a period of time or not. I think that's a problem. And coming back to the education, I agree with you, but then I say to myself, that sounds like politic-speak. I'm not saying you're trying to do that. I'm saying, but here we have the problem. How do you go in as the schools or the early childhood education centers and so forth and beat the parental situations where they're supposed to be the primary educator, and yet at the same time, the only system they know is learning the one that they learned from the previous generation? I mean, that to me is the $20 billion question.
And that's why education is so important, because if we get them out of the home early and into a quality child care program, which is the only ones we will not invest in programs that aren't high quality.
Okay.
That aren't
and you
teaching,
have a set of standards, I'm assuming.
Absolutely,
that hit that.
We do. And that aren't teaching children what they need to know. But clearly it's about, if we really want to break the cycle, and Gary, I've thought about this for years. Because, as you know, I was with the York County District Attorney's Office. I work for children and youth. I've worked in all aspects of health, human services, criminal justice, juvenile justice. The only way to do this is to make sure that people have the education, and it has to be quality education, the skills to get into a job. And, there was a lot of things. People can get involved every day in their school district, in their community. They can expect good results. And I look back now as a parent, and all my kids are doing very well. But there are times when I thought, what, my child's not getting. This teacher is not the best. They're not learning what they should. I should have been more involved. And we all need to do that because I don't want to just spend money and throw it at school districts who aren't educating our kids. But I want to make sure that our kids are getting what they need, and the money should go to the education. I don't see any other way to break the cycle. And from every aspect that, we can do what we can. We do welfare to work. Yes, we do.
Right.
We provide Job Gateway where people can go in and look and match their skill sets to jobs in their area. It's a great tool. It doesn't break the cycle of welfare dependency.
Bev, we're going to do it again sometime soon.
Absolutely,
Thank
Gary.
you for stopping in today.
You.
I appreciate it. It's great seeing you again. And people, again, can call you right there at the Department of Public Welfare. Bev Mackereth was here on the Gary Sutton Show. And if you missed any of this morning, you want to catch it, we had almost an hour. Go to facebook.com/910WSBA. You'll see Bev's shining face there, and you can hit that and listen back to the segment. And thank you to Brian Dean for putting that together. Final thought today. This comes from George Bernard Shaw. I'm afraid we must make the world honest before we can honestly say to our children that honesty is the best policy. Works pretty well, doesn't it? Monday on the Gary Sutton Show, John the Boutelier joins us, a former congressman, the tri-host of Political Insiders on Fox News. You can watch him, by the way, at 5:30 on Sunday. Make that 7:30, excuse me. The State of the Union Eve. We'll find out what he thinks the State of the Union is. Joel Sears will be in from the York County Taxpayers Council. And then we ask you, what do you think the State of the Union is? You tell me on the Gary Sutton Show. Have a great weekend. It's noon.